On a recent trip to Los Angeles, we caught up with Dr. Gerry Chader, who is the chief scientist at the Doheny Retina Institute at University of Southern California School of Medicine. Dr. Chader's research focuses on the cause, prevention, and treatment, as well as the cure of retinal disease.
Retinitis pigmentosa is really a family of diseases. It's a catchphrase for a grouping. Right now there are well over 100 gene mutations that are known to ultimately result in one form or another of retinitis pigmentosa. What is noticed is that very often, since it strikes fairly early in life, either at birth or soon thereafter, a parent will notice that a child is clumsy at dawn or dusk or under low light conditions, is bumping into furniture, is having a little trouble managing mobility. And they're thought of either as slow or clumsy or something like that. And in fact, they're not. And in fact, these are the early signs of retinitis pigmentosa. The two hallmarks of RP are that there is a loss of peripheral vision. Again, they don't see a baseball coming at their head as such from somewhere out in left field as such. And secondly, that because the rod photoreceptor cells are the main cells affected and are in the periphery, and thus peripheral vision is lost then first, but also rod photoreceptor cells subserve dim vision as such, bright light vision, daylight vision as such, mainly subserved by the cone photoreceptor cells. So with rods going awry, genetic mutation mainly affecting the functioning of the rod cells, then the peripheral vision and the dim light vision are the first to go. And so at age 3 or 4, a parent is saying, Johnny, get up out of that bed and get into the bathroom and brush your teeth or something, and Johnny stumbles and goes into the door jamb as such. So it's silent, there is no pain. It comes on usually quite slowly. So a parent will often take the child into a pediatrician rather than an ophthalmologist, not understanding that really this is an ocular condition. And hopefully then the pediatrician realizes, in fact, what's going on. There's an eye exam, and that really can't be an eye exam just for acuity, because very often the acuity in an RP patient is very good. I know people with various forms of retinitis pigmentosa who have what is called, they're adults now, and they have what is called shotgun or tunnel vision, only a few degrees, 5 or 8 degrees of vision, and so it's like looking down the barrel of a long shotgun. But they can read the fine print in the New York Times as such, because their visual acuity is just fine in the macula. It's the rest of the retina that's gone to pot. They can't drive, anything coming at them out of their peripheral vision is not seen at all, but they sure, with scanning, can do pretty well in reading and face recognition and other things like that. The other more obvious problem in retinitis pigmentosa is presented in congenital forms of RP. There is a form of RP called Leber's congenital amaurosis, LCA, and basically the child is born blind, has wandering eye, nystagmus, the eyes wander back and forth as such. And so this is a lot easier to spot because the child is not focusing on the parent's face. The eyes are wandering back and forth after a few months after birth. And so pretty quickly, these children are taken into the ophthalmologist. There is one treatment right now that is, thanks to the good research of Dr. Elliot Burson at Harvard Mass Eye and Ear Infirmary in Boston, Massachusetts. Back in the 90s, Elliot found that many of his patients were on higher regimens of vitamins, and some of these seemed to do a bit better. And so he chose two vitamins, vitamin A and vitamin E, to do an in-depth study of, and found that in some patients on a vitamin A, very high vitamin A regimen, but safe, that the vision was improved. But only some patients, and the vision was only slightly improved, such that vision in those patients continued to decline, but at a slower pace. So his estimate was 8 to 10 years or so of prolonged vision in those patients. So to date, to right now, the only treatment as such for retinitis pigmentosa is in this vitamin A treatment. That doesn't mean that hopefully next year or the year after, this is going to be the only treatment, because we have at least 5 different directions in different areas of research where there is good hope for treatments and cures coming.